So I'm here with Dr. Marcela Gallas, and we're at the workshop which is assessing the capacities for antimicrobial resistance, determining direction, surveillance, and laboratory quality awareness. Tell me, how beneficial would this work, would this meeting be for St. Vincent and the region when you have completed it?
Okay, as you know, antimicrobial resistance is a big problem at world level, and World Health Organization is working in solve the problem or collaborate with the solving of the problem. And for that, they prepare and they communicate a global plan of action to content or to fight with the antimicrobial resistance at the world level. And in this frame, each country in the world are preparing the national plan of action to combat the antimicrobial resistance, because we are near of the no drugs, no alternative for the treatment of common infection at world level. In this frame, the countries in the Caribbean are working in the national action plan, and one of the key subjects in the national plan of action are the data. To change something, you need to know what's happened. The knowledge about the situation is given by the laboratories at the hospital, the laboratories at the production of food for humans, and the food laboratories also, and obviously also the environment laboratories. Then we are working in this workshop in the improvement of the capacity at the laboratories at the region, especially in ECC countries, in Eastern Caribbean countries, but also in the rest of the countries in the region of the Caribbean, in the Caribbean countries. For the country, the importance of this workshop is to improve the lab capacity to produce data. To produce data in order the authorities can take actions to content the antimicrobial resistance. In this frame, we design a project with PAHO ECC, the PAHO Eastern Caribbean countries, to assess the capacities through the visit that we make. We already did that, we have done. And in this workshop, we will analyze the results and identify the gaps and planify the next steps to improve and to cover these gaps. This is the importance of this workshop. We hope we can continue working together with the countries of the Caribbean to improve the capacities the lab to produce data. This is the idea, the general idea. Yeah? We identify a lot of strengths, but we identify some weakness that we have opportunities to improve that we need to address at this moment to fix. Yeah?
What will your presentation be on?
Sorry, again?
What will your presentation be on?
The presentation, it will be the results of the visits, yeah, and the identification of gaps. Yeah, we present the gaps and the possibilities of solve these gaps, of address these gaps, and also a proposal for training for the next steps at the Caribbean. Yeah, we have several proposals to discuss with the people here and to make a consensus what will be the next step for you. The idea is to help you in improve the thing that you are doing based in your needs. No, in our dreams is your needs. This is the idea.
Yeah. All right, thank you so much. So we heard Mr. Elliot Samuel, and he's the Chief Lab Technologist, pretty much the man in charge of the lab. This workshop is, I would say, timely and would be of big assistance to you. Just give me some background, and how do you feel about being able to participate in it at this level?
Well, I must say the workshop is definitely timely. Around the region and internationally, laboratories are building network, and it's all about how the lab provide information that supports the clinical care team. They would say that if the information is not being supported by the laboratory, it's really your opinion. I've just concluded a workshop in Jamaica where we actually forging networks in the region to strengthen capacity for the lab to provide better and more timely information. This workshop is really about antimicrobial resistance. It's really a global problem, and how the lab can strengthen their capacity to better detect, to better surveil, to better report on antimicrobial resistance in the region.
So breaking this down for St. Vincent, what does this mean? That mean in terms of data collection aspect of it, or the physical part of the day-to-day runnings of the lab? What would essentially happen for persons who don't understand these
Well,
fancy terms?
antimicrobial resistance really relates to how bacteria, viruses, microorganisms are able to build resistance to drugs, the drugs that we commonly use to treat them. The laboratory is that point where we are able to detect the resistant mechanism that these viruses, these bacteria, these other organisms actually carry, and how they're actually able to resist the use of drugs that are used to treat them. Without the laboratory, we are really aiming blind. We're in the dark. So the laboratory has to be able to detect all the different types of mechanisms. And I don't want to get too complicated, but we have heard things like methicillin-resistant Staph aureus, extended spectrum beta-lactamases resistance. So we are actually now in the process of building our capacity to detect these resistance, so we can better inform the clinician that the drugs of choice are not working and what can be recommended for treatment.
So essentially, we're just putting ourselves in a better position to cater to the needs of our people.
To cater to the needs of the populace.
So we're here with Dr. Wayne La Bestia, and he is representing the Caribbean MedLab Foundation. He will tell us a little bit about that, and then talk to us a little bit about what he would be presenting later this afternoon.
Well, the MedLabs Foundation is a mechanism that was designed to continue the activities of a previous project funded by the European Union to help move the Caribbean labs into a state of accreditability, meaning that there are many challenges with delivering quality among the medical labs, and accreditation is one mechanism to ensure, not necessarily guarantee, but ensure better quality and reliability of the data that comes out of laboratories. So once the project was finished, the CARICOM asked for a mechanism to continue the work that needed to be done, to continue to move our labs along the continuum of quality improvement and implementation of quality management systems.
So your job essentially looks at the good, the bad, the indifferent.
And help to move the labs along the continuum of understanding what to do, training people how to get it done, so that eventually we're hoping that there will be an environment where labs are required to be accredited, and therefore they will be in a position to be accredited. It will improve the reliability of data all around, because 70% or more of medical decisions are based on laboratory evidence. Most of, laboratories are the only entity in the healthcare system that actually provide actual evidence. Everything else is pretty much opinion.
Okay. So what would your focus be in terms of the meeting today?
Well, information systems are critical to labs, because illness management or public health care is all about managing right information. And we have to be able to use the information generated in a way that will allow us to know what's happening either in individual patient care or a population's health. And what labs do is really complex, and most people don't understand the complexity. So people offer to design information systems for the labs that don't actually help the labs do what they need to do. And everything that a lab does, from the time it takes responsibility for a specimen to the time the result gets back to whoever needs it, requires documentation of all the correct things having happened before you can rely on the result. A lot of the time, we give the labs a tool that just feeds into a bigger picture at the end of their process. That's not useful for the labs, because they have a whole complex procedure that they have to do manually, and then on top of everything that they're doing, feed a bigger picture. What the labs actually need is something that will help them manage the complexities of getting a reliable result out to whoever needs it. And the primary product of a laboratory is information, whether for individual patient care or for population health care.
So we're here with Dr. John Stellan, and he's representing WHO at this PAHO WHO at this workshop. So you're going to tell me about your role here today and what can we expect at the end of this workshop.
Sure, I'd be happy to do so. So I'm in Boston at one of the Harvard Medical School teaching hospitals. I represent the WHO Collaborating Center for Surveillance of Antimicrobial Resistance. I've been working in this now for 28 years. Been here a little while, and it's really a great pleasure for me to be working here in the Caribbean. I've visited now practically all the countries. I have a few more to go, and I'm very pleased to be involved here to support the activity. My personal area of work is in surveillance of antimicrobial resistance. The WHO Global Action Plan for Control of Resistance has 5 pillars. One of them is improved knowledge for tracking the issues. So that's my area. It's every country, in a general sense, resistance is bad around the world and getting worse, but the details are different. Some countries this is worse, some countries that is worse. Here things might be changing quickly, here things might be changing slowly. Very importantly, this is what's happening on the community side, the hospital side, the food and the animal side. This is all related in terms of the microbial populations that are changing around the world. So my involvement is I write free computer software called WHONET to help laboratories collect the data and to use those data on a day-to-day basis for alerts, new threats. We haven't seen this before, please confirm this. And in the medium and longer terms, for finding outbreaks to guide policy, to help to support interventions, and then to evaluate those interventions. You think you have a good idea, you try it, did it make a difference? Did resistance come down? Did infection come down? Did the nature of the organisms get worse or better? So my role is more on the data collection side of things. And that is one of the important subjects of this conversation. But a lot of data collection is related to how you use the information. Not only what's happening with the organism, surveillance of resistance, but surveillance of antibiotic use, surveillance of knowledge and perception and practices, and then to tie that to improved decisions, improved clinical care, improved hygiene in the hospital setting, improved hygiene and sanitation in the community setting. So this is all one big effort to look at the many facets of resistance and trying to make sure with the information needed to guide those interventions and to evaluate their efficacy.
So at the end of this workshop, St. Vincent would have been in a better position in terms of its ability to surveil or anything lab-related?
I think certainly, in part from the information that the external consultants have to share based on our international experience or work directly with the World Health Organization and other regional and international bodies, but I think also the experiences of the member countries. So a number of the countries have done very nice work in different elements of what I described, on the surveillance of resistance, on community outreach, on education, on infection control. So I think a key element of the success of this meeting will rely on the communications networks and sharing of experiences that have happened in this region.
In relation to your work, if you were to give one piece of advice to persons who may be looking at this interview, what would that advice be?
Well, let's see. Use antibiotics wisely. Some people need the antibiotics to live, to get better in a more reasonable period of time. But the most common reason people take antibiotics is inappropriate. I don't feel well today. I'm tired. I need my pill. We talked earlier today about a study where nearly half of people in low-resource countries had taken an antibiotic in the previous month. We've managed to survive on this earth for a very long time without monthly antibiotics. So antibiotics are very important medicines that can save lives. But many people use antibiotics for reasons that don't help them, but can lead to resistance, which can be an issue for them personally in the future, and for their community and for their country as the resistant bacteria spread. So I think an important message is that antibiotics are extremely important, but they must be used wisely so that we can rely on them for future generations.
So we're here with Miss Andrea Williams from St. Kitts. Welcome to St. Vincent. And she's a participant in today's workshop. Can you tell me how has it been so far and how beneficial it would be to the work that you're doing back home?
Well, thanks for having me, and I really appreciate being here. Being at the workshop today, it's really very beneficial for us. We have actually started our work in St. Kitts on antimicrobial resistance, And so far, we have been sensitizing all healthcare workers uh, about the whole impact of antimicrobial resistance. Being here today, it's really to sharpen and to put more emphasis on the need for us to be very aware and to complete our action plan, which needs to be done in order to curtail and to prevent the misuse of antibiotics. Um, St. Kitts may be small, but we are a part of the entire global phenomenon, and so we are not excluded from any casualties that may occur due to antibiotic misuse. So this workshop is very informative. What it really also emphasizes is what is happening in the region when pertaining to antimicrobial resistance and how we as a region can come together and work together, share resources in helping to curtail this phenomenon.
If there is one piece of advice that you would give to persons throughout the region in terms of what they do, in terms of antimicrobial resistance or just lab work in general, what would that be?
Well, definitely to reduce your use of antibiotics, especially for simple infections, simple things like the cold. Most of us in the region would tend to go for antibiotics in order to help us to feel better. Another thing also would be to make use of the information that is out there on antimicrobial resistance, because the life we save may very well be our own.